Welcome, dear friends. Here we have a special guest to make an interview, and that is none other than the chief guest of this day. And he has made all of us very much happy and very much proud. His name is Dr. Gunda Jaya Hareesh, and I welcome you, Doctor, with a lot of pride to this interview.
Thank you, sir. Thanks a lot, sir.
So this is a special day. This is a special day for you as well as for all of us, all the teachers, because we always feel happy when we see good results, when we see our students coming up in the higher ranks, or even if the others who have also tried very much and didn't get a higher rank, if they have tried their very best, that itself is an significant achievement, I feel. So welcome once again, and I feel. How do you feel now?
Sir, I'm very happy, sir. Actually, I was preparing whole these 2 months to
Okay,
get a seat in this. So I was very happy after knowing the result. I did not expect I will get first rank. I thought I will be getting some seat in a college
okay.
like AMCL or PGI. My aim was
So
to go into AMCL or PGI.
okay. Your name is Dr. Gunda Jaya Harish, and I think that I know that you are from Gundur in that is in Andhra Pradesh or
Andhra Pradesh.
Telangana?
Andhra
Andhra
Pradesh, sir.
Pradesh. Can you just tell about yourself?
Sir, myself Gunda Jaya Hareesh. I am from Guntur, Andhra Pradesh. I have done
Mhm.
my MBBS in AIMS Bhopal, then
Okay,
completed my MD in General Medicine from JIPMER, Pondicherry. I have completed
okay.
my general medicine in January 2024.
Oh, okay. So you are having a degree in general medicine.
Yes, sir.
Yeah, yeah. Okay. That's really great. We have completed only in this Jan 2024, right?
Yes, sir.
Okay. So I would like to know how what made you interested in this pulmonary medicine so as to pursue your DM?
Basically, I like interventions and critical care at the same time.
Okay.
So, as I like critical care and interventions, and I tend more towards pulmonary manifestations of many of the systemic diseases. So
Okay.
I thought it would be a better choice for me to take pulmonology and critical care.
Good, good, good. So you had a good exposure in pulmonary medicine during your MD medicine time?
Sir, I have seen most of the cases of asthma, COPD, pleural effusion, lung
Okay.
cancer, sleep, and all. We had very less exposure, sir.
Okay. You have a pulmonary medicine posting also as a part of MD, or you see
No,
the
sir.
respiratory cases in medicine only?
We will see the respiratory case in medicine, sir. We don't have any separate pulmonary medicine posting.
Posting there.
Different department of pulmonary medicine. Our JIPMER runs MD in pulmonary medicine.
Ah, yeah, yeah, yeah. Okay, I thought that you had a specialty posting there because in
No, sir.
our college where I took MD and DM, it was there. That's why I asked.
No, sir.
So, Jaya Harish, I would like to know one thing that you were preparing for the final year MD exam, and when did you start preparing for the INI specifically?
Specifically after completion of my final exams, MD final exams. Actually, JIPMER is very hectic. First year and
Okay.
second year, it was not possible for me to read anything properly. Only I used to see
Yeah.
videos of Marrow, super specialty videos of
Okay.
Marrow. Whichever case I was seeing in the ward, I used to come back, see the video. If time
Oh,
permits, I will just open the books. But when I entered
oh.
final year, But
Hmm.
when I entered final year, I used to get some more time. So I thought of seeing majority of the videos, whichever
Okay.
is possible. So
Oh, very good.
mostly it was case-based learning only, sir.
Case-based learning. Okay. This I would
Yes.
like to. I am very much impressed, and I would like to share to those who are watching this video also. What Dr. Jaya has said is a very important point that you can follow. He has seen cases and he has watched the video which is related to that particular case. That is the finest way of learning, I think. So, how Marrow was useful in your MD exam? Was it helpful? MD final year medicine exam?
Sir,
Was Marrow videos useful for your MD final year exam?
yes, sir, it is very useful, sir. Actually, majority of the part, whatever is required, is given in Marrow. So
Okay.
I used to see videos. I used to go back to textbooks. I will just see the tables and important points whichever are necessary and make my own notes if possible and
Oh,
read the same notes if required.
okay. So, you subscribe Marrow in which year actually?
Sir, actually, I had taken Marrow during my UG preparation. Uh,
Final
that
year.
medicine you sir, final year during my internship in MBBS. Uh,
Okay. Oh,
Later,
that time itself. Okay.
yes, sir. And then I used that medicine part during a first year and all. I was not able to read anything. I used to just
Hmm.
work there. In mid
Uh-huh.
of second
Second
year,
year.
around fourth semester start, initial fourth semester, I took Marrow subscription. Sir.
Mhm. Okay. So by the middle of second year, you started watching it again.
Yes, sir.
Okay. So, what was the way of preparation while watching a particular? You told that you will see a particular case in the ward and then see the video which is related to it. And
Yes,
while
sir.
listening class, whether it is pulmonology or medicine or any other subject, you will once listen the video and then you will make your own note, or you will just hear it and memorize. How was your method?
I will not be able to make a notes after tired duties. Just I will be seeing the video if possible and
Okay.
use the Marrow Notes app, which is there in
Uh-huh.
the
Along
app
with the
itself.
video.
Yes, sir, along with the video. That
Uh,
is actually some point is missing in the notes given by Marrow team. I used to just write in my notes and I used to keep it aside.
So that notes portion is very useful, right? What we give
Yes,
along
sir.
with the video.
Yes, sir. It is useful for
Okay.
revision also, sir. Basically, if you forget, I mean, if you have seen a video today, tomorrow, if you are going back to what, if you forget some point, if you want to see what, you can go back to
Uh,
Marrow Note and you can just
okay.
remember
Suddenly
what
you will
was
correct.
told.
Okay. So which all other subjects you referred?
Sir, I have seen most of the cardiology, neurology, nephrology,
Hmm.
and pulmonology videos, sir. Immunology and endocrinology, I have seen only general medicine videos. Rakesh sir videos I have
Yeah.
seen.
Okay. So in how was your preparation for the last moment? I mean, the exam. Which was the date of exam? I forgot.
Sir, April 27th was exam date.
So you finished them by around February. So how was the preparation in February, March, and until the April beginning of the exam? I mean, the last moment preparations.
After completing my course there, I came back home. I did not work anywhere. I thought I will give a good attempt this time, but it is not possible. I thought of joining somewhere else and plan accordingly. So
Okay.
these 2 months, I have seen all the pulmonology videos. I have
Okay.
read part of critical care medicine from Harrison,
Okay.
and by after 1 month of starting of preparation, that is early March, I have completed watching all the pulmonology videos.
Oh.
Then I started seeing Fishman parts, I mean bits and parts. Whichever chapter I have
Hmm.
doubts, whichever chapter is more important or I'm not able to memorize, I used to go back to Fishman and see important tables. Just read whatever is required for the exam, not like important topics.
Okay. And you made notes, your own notes in between also?
Yes, sir. I have made all the notes. I did not use Marrow notes this time. Whatever
Uh,
during seeing videos, I have written my handwritten notes. I have added some
uh,
points from
the
Fishman while
textbooks
reading,
also.
sir.
Yeah. Then a sudden revision also.
Yes, sir.
Okay.
Once I have completed my notes,
So,
it was almost around March second week. Then I have revised completely everything for almost 8 to 10 days.
uh,
By the time it was early April, Then I started giving some. I have given some 6 mock tests.
Okay.
And I was able to revise once again all the notes, sir.
Okay. So you made a 2 times revision, right?
Yes, sir.
So the one who is preparing for the exam should finish it by at least 1 month prior to the tentative date.
Yes, sir.
Minimum. Okay.
Yes, sir.
So how was the mock test useful?
Sir, I felt it was very difficult because I was not able to complete my revision
In time.
properly.
Hmm.
So I did not give that mock properly, sir. Actually,
Hmm. But
it was
does it
useful.
help in adjusting the time and all?
Yes, sir. As time issue was because it was 80 questions and 90 minutes, and timer will be there all the time. If I'm
Hmm.
taking more than 1 minute, I used to skip the question. I used to not waste the
Okay.
time on that. I I thought
Okay.
we can get back to that question at any point of time. So I used to not waste more time on one question.
Okay. So how was the time? Was it okay with the final exam?
Yes,
You
sir.
were able to finish it
My
on time?
my aim was to complete exam in 80 minutes, 80 questions, 80 minutes,
Hmm.
and 10 minutes
Hmm.
as spare to
For the
revise to review
revision.
all the questions.
Okay.
So I was able to complete
That is.
my paper almost by 77, 78 minutes. Then I took some 6 minutes to
Oh.
review all the question paper once. Then 5 to 6 minutes to
Okay.
see 7, 8 questions which were remaining.
So, Doctor, is there any area you got a special benefit from the topics that we have discussed in our modules? Any specific areas?
So actually, as I am a medicine person, I will not be having much of knowledge from pulmonology. So
Hmm.
I felt while seeing every video, I felt something new I am learning,
Okay.
especially something like hemothorax, chylothorax,
Mhm.
lung malignancies, and asthma guidelines, new updated
Okay.
guidelines of asthma, GINA
Yeah, yeah,
guidelines,
yeah. Really good, yeah.
gold guidelines. So whatever we during my MD days, I used to not see many of the guidelines of pulmonary diseases. We will be seeing
Okay, yeah.
guidelines for other diseases, but less for pulmonary diseases. Although there will be some weightage for pulmonology in our syllabus, so new guidelines and the effusion part, lung malignancies.
Yeah.
I felt I learned so many
Real.
points from your videos.
Okay. Happy to hear that. So, watching these kind of videos definitely helps to save your time, right?
Yes, sir.
Okay. So, Doctor, how was your preparation for the interview?
Sir,
Anything
interview,
specifically you have done or?
sir, interview. I asked my seniors. They told they will be discussing more about emergencies and some question
Okay.
on ventilator.
Ah.
Uh, Ventilatory strategies for management of ARDS or any ventilator associated pneumonia,
Mm-hmm.
pneumothorax, some emergencies and acute exacerbation of COPD, acute exacerbation of asthma. So they told they'll be discussing more about emergencies, ventilatory
Okay.
strategies, and very little about pulmonology in core.
Okay. In the interview.
So
Okay.
as my seniors has told me that, so I planned accordingly. I was able to revise ARDS properly,
Mm-hmm.
and parts of fibrotic diseases, go and revise guidelines, parts of guidelines I was able to see. So I planned accordingly to revise one more time the notebook, whichever I have prepared.
And how was the actual questions? Was it related to emergency or something else? Did the
They asked
seniors
me about ARDS.
advise you correctly?
Sir, they asked me about ventilatory strategies in ARDS,
Oh, okay, okay.
and then they asked me about fibrotic lung diseases, and then
Hmm.
they asked me about specifically about drugs like nintedanib and pirfenidone side effects.
Okay, 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 okay.
What is the dose of the drug?
Hmm.
And they asked me about an antibiotic, Yelloris, which I don't know, sir.
Oh, okay, okay, okay.
Uh, and uh, and then it was like diabetes management, how you will in hospital management of diabetes, sugar control.
Oh, so there's questions from medicines also, medicine side
Yes,
also.
sir. That I was able to
How
answer.
ah, how long did the interview last?
Sir, 8 to 10 minutes, sir.
Only that much. Okay.
Yes, sir. There's only six
You
questions.
will
Only three panelists were there. Each was asking two
only,
questions.
so 6 questions.
Yes, sir.
You will walk in bare hand, nothing laptop, nothing with you, right? During
No,
that
sir.
time.
Online, sir. Online interview.
Online interview. Okay, it was an
Yes.
online interview. Correct. So, what are your tips to the upcoming candidates, doctor?
Sir, first, a- as I am from general medicine, I will suggest to my general medicine juniors that if you are interested in critical care and interventions, and major part of interest is towards pulmonary medicine, can tend towards taking pulmonology and critical care. Then, as preparation, Marrow would be better initially in initial stages of preparation, but has to see parts of Fishman and give exams at give exams beforehand so that time management would be sufficient.
Okay. So, from your experience, what I feel is that someone who is preparing for the MD exam can prepare at the same time for the NEET SS or INI SS exam also. It is nothing impossible, right? It is
That is
possible.
true, sir, but they have to decide prior hand before their exams that they have to take specialty. Some will be confused at the end of course whether to take
Okay,
one
which
specialty or
specialty?
the other. Yes, sir.
Yeah, yeah. Last time also we have our own students, Dr. Amal and Dr. Anjali. They were my own students and they prepared for their final year exam as well as for the SS exam at the same time.
Okay.
So
That
you
would
are
be a
just like
good
that.
choice, sir.
Yeah. So when does the course begin or any idea regarding that?
So July 1st is the reporting date. They did not give about counseling dates yet to be released.
Okay. So where are you planning to join? Where do you like?
Sir, I am thinking of PGI or AIMS Delhi, but I am not sure, sir. I am discussing with the seniors currently.
Okay. So how many questions did you attempt, Dr. Jaya,
Sir, I have attempted
out of
79, sir.
80?
79 out of 80. Yes, sir.
Oh, so you skipped only one question.
Yes, sir.
What was that question, doctor?
Sir, it was drugs for obesity and which drug is having most of weight loss. So I was
Okay,
not
okay,
able
okay.
to think. I was not
Not
able to think
directly
what was
related
the.
to.
It is not
Okay.
related to
So
pulmonology, sir.
out of 79, did you make any guesswork? Yeah, yeah. So did you make any guesswork like 50-50 cases? How many questions were there? And you may
Almost
exclude C and D, then you have got left with two options. Then such kind of questions, how many you tried? How many were there?
almost 6 to 7, sir.
6 to 7. 50-50, you selected one based on this weightage, you know?
Yes, sir.
Okay, okay. Rest you were confident in answering. The rest of the questions around 70.
Yes, sir.
So one more question that is there any way that we should improve, doctor, in the
Sir,
classes, in the discussions,
cases,
in the modules,
addition of cases would be cases and how to uh, approach
uh,
the case. Case-based scenarios
handle
would
it?
be ideal,
Yeah, yeah.
and
That will be added soon.
yes, sir. Apart from that, I felt most intervention part is less. I mean, part of it is less, sir. Basically, interventions like
Okay,
e-bus, this
okay,
and
okay.
all were not discussed actually. So I have to go back to Fishman and
EBUS,
see
one
all
class
these
is coming.
interventions.
Fishman, EBUS is it's not that much given also. Yeah, that will be added in the coming up month.
Yes, sir. Apart from that, everything is
Mhm.
adequate. Only I felt was this intervention part was which I don't know more. Majority of the interventions I don't know, sir.
Yeah, yeah.
Coming from general medicine background.
That
So
medicine. Yeah, yeah.
yes,
Yeah.
sir.
So one
So
more thing, how is the interface? How to use it? Is it user friendly?
it is very user friendly. I have been using this since
The
my
Marrow app.
MBBS. So I have been
Uh-huh.
using this since my MBBS, therefore it is not a problem, sir. It is very easy and very user friendly.
Okay, okay. So, anything else, doctor, you would like to share?
Nothing, sir.
So, thank you once again, doctor, for
Yes.
sharing your experience and for your time. Wishing you
Thank you,
all the
thank
very
you,
best from myself, from my family, from the Marrow fraternity, and all the other faculties, including you have asked the videos of Dr. Rakesh, cardiology, Dr. Nishant, neuro, everyone else from their side also. I would like to appreciate you for your splendid victory. Keep going and wish you all the best. God bless. Thank
thank
you.
you, sir. Thanks a lot.